Welcome to Wednesday's edition of COVID-19. We are well into our second year of the pandemic, and given the prolonged affair, questions are being raised about its endgame. Now, we have more on that scenario later on the program after a look at the latest COVID-19 numbers here and elsewhere with our Kwon So-ah. Now, So-ah, here Korea has recorded over 2,000 new cases on this Wednesday.
Right, Sunny. That 2,000 threshold is always alarming to hear, but it's also something that's been usually happening on a Wednesday. So for a closer look, 2,080 cases were tallied as of 12 a.m., and that is a spike in domestic transmissions. However, a drop in imported cases this Wednesday. And the big concern right now is the spread in the metropolitan region, especially here in the capital Seoul, which has recorded its highest daily number of infections at 804 when it comes to domestic cases. And it's the first time that Seoul has surpassed 800 daily infections. And it's even around 130 more cases than the previous record of 677. Now, the greater Seoul area is making up over 80% of recent infections, as you can see here, 80.5% as of 12 a.m. this Wednesday. And if we take a closer look now by region, as I said, 804 domestic transmissions, but when we include the number of imported cases that were detected during a self-isolation period in the capital, that's 808, and also a rise in Gyeonggi-do province and Incheon. We do see some places with single digits, though. Jeju Island, Jeollanam-do province, and Sejong City are places that are now seeing gradually a decline in infections. If we take a look at our graph now, you can see here that big jump from yesterday, but if we compare Wednesday's figures when we usually have higher caseloads, it's similar in the recent weeks as we are seeing over 2,000 in the past month or so. And with that, Korea has accumulated 277,989 infections with a death toll at 2,380, and here a concerning double-digit of fatalities that have occurred in the past 24 hours as of 12 a.m. this Wednesday. And let's also move on to the vaccination process here in the nation. Here, a milestone: over 40% of the nation's population has been now fully vaccinated against COVID-19. Let's move on to the international figures. With over 568,000 new infections, the total number of cases stands at 226.6 million. If we go over to our next table, we are seeing the countries worst affected with COVID-19 in infection numbers. But it's now not only these 20 countries, but if you go over to our next table, we've got Malaysia, who's now become the 21st country in the world to surpass 2 million cases in total, seeing more than 15,000 infections happening in the past 24 hours as of noon Korea time. And in our later segment, we're going to take a closer look at Russia and Germany, which now have over 7.1 million and 4.1 million cases in total. And those are the updates I have for now, but I'll see you back in a bit. Sunny?
All right, so thank you for those figures. Right, up next, we bring you the latest on the treatment front as pundits claim an oral drug for COVID-19 may be available within this year. For more on that, I have our Kim Sung-yeon here in the studio with me. Sung-yeon, welcome.
Hello, good afternoon.
Now, I understand authorities here in the country are already engaged in talks to secure these oral treatment options.
That's right. Sunny, Korea is holding talks with a multiple number of global pharmaceutical companies to pre-order these COVID-19 treatment in pills that can be taken orally, which promises to be a significant game changer in the pandemic. Now, the government said last week that closed-door meetings have been held with these firms to purchase their treatments in advance before their expected launch later this year. The KDCA earlier announced that they have set aside 16.8 billion won or 14.3 million US dollars from this year's supplementary budget to purchase enough drugs for 18,000 people and 19.4 billion won to buy 20,000 people's worth next year. Health authorities have been emphasizing the need for oral COVID-19 pills, which would allow people to medicate themselves at home without the aid of a medical professional. Baek Young-taek, a senior health official, said last Friday that treatments that are administered with a syringe would be difficult to use at home and require patients to be hospitalized. He added that treatment pills would allow patients to monitor their own conditions at home without taking up hospital resources.
Right. Now, Sangyeon, one of our panelists earlier this week here in the studio touched upon the controversy over the cost of those oral drugs now. Could you address this concern for us?
Yes, so there's quite a bit of controversy indeed, Sunny. Some say these pills are cost prohibitive compared to other treatments, and their manufacturers are being suspected of eyeing excessive profits. But the Korean government addressed these concerns by saying the cost of these pills will be fully paid for by the government. Now, when you crunch the numbers, a 36.2 billion won budget to buy treatments for 38,000 people, that would boil down to a cost of 950,000 won per person, or over $800 US. One expert explained that 2 pills would need to be taken daily for a total of 5 days, and that the cost of each individual pill may be roughly between 80,000 to 90,000 won. And as I mentioned, the Korean government said Monday that it will cover the full cost of the treatment if these pills are introduced. Son Young-rae, another senior health official, told reporters on Monday that they are waiving all co-payment obligations for the public, and that in Korea, the entire treatment process for COVID-19 will be provided free of charge. COVID-19 has been classified as a level 1 communicable disease, and the Infectious Disease Control and Prevention Act stipulate that such illnesses legally mandate the government to provide free treatment.
Right, well, that is comforting to know. So which firms, Sangyeon, are developing these drugs?
Well, there are several global pharmaceutical companies, Sunny, but among them, Merck looks to be ahead of its competition, with the firm seeking emergency use authorization from the FDA for its drug molnupiravir in October at the earliest. Now, according to Merck, molnupiravir is an investigational oral antiviral candidate for treatment of mild to moderate COVID-19, and it's expected to be commercialized before the year's end. Besides Merck, Pfizer and Roche have also launched phase 3 clinical trials for their own drug candidates. Now, for now, though, because no oral COVID-19 drug has yet been approved, health authorities here say it is difficult to say exactly what impact it could have in our fight against the pandemic.
There are hopes that oral treatment drugs could help stem the outbreak if they're successfully developed, but none have been approved so far, and it remains to be seen how effective they can be.
Nonetheless, we have seen tangible progress, and there's hope that such drugs will keep more COVID-19 patients from becoming seriously ill. KDCA Commissioner Jung Eun-kyung said last week that treatments will make it possible to effectively manage patients in the early stages and help the country better contain COVID-19. The KDCA also said that having more therapeutic options is essential for the government's long-term exit strategy from the pandemic. Now, in the meantime, Korea's drug regulator has given the green light to 11 local pharmaceutical companies to go ahead with clinical trials for their respective drug candidates. Experts are forecasting that these drugs may become ready for commercialization sometime next year.
Right, and those drugs are, of course, domestic productions.
That's right, local ones.
All right, Sangyeon, as always, thank you very much for the coverage.
The pleasure is mine.
And it's time now for the latest pandemic-related remarks by relevant officials here in the nation with our Kwon So-ah. So,
Hi again, Sunny.
right, so let's begin with the authorities' take on the surging caseloads here in the capital region that you touched upon earlier.
Sure, that was one of the main areas of focus at the government's briefing earlier, which was held by a senior health ministry official, Son Young-rae. So let's begin with an assessment of the infections in the greater Seoul area, on how many people have been infected in recent days and also where these cases are emerging.
일주간의 인구 10만 명당
The average number of patients in the capital region stood at 5.1 per 100,000 people in the past week, with 6.7 in Seoul, 4.6 in Incheon, and 4.1 in Gyeonggi-do province. It's a rising trend. Recent infections have occurred at all types of confined spaces with high risk of droplet transmissions, including workplaces. We are looking at businesses with many foreign laborers in particular, and also cram schools, sports facilities, singing room, marketplaces, one-room student accommodations, and churches, among others.
Son added that people should refrain from going to crowded places as well as venues where it's difficult to keep your masks on. And as we're just a few days ahead of the Chuseok holidays, he also reiterated the following.
계속 반복해서 당부드리고 있듯이
As we have continually reminded the public, we ask you to refrain from traveling to your hometowns for the Chuseok holidays if your parents have not been fully vaccinated. This is particularly important for citizens in the capital region, to whom I want to make another request that you not use the holiday period to go on vacation to other regions.
Right, of course not. Meanwhile, so I also believe there are some measures in place to address the growing number of infections among foreign workers here in the country.
That's right, Sunny. In the past week, foreigners made up around 15% of COVID-19 infections, and infections among those foreigners has been on the rise for the 8th consecutive week. So the Korea Disease Control and Prevention Agency decided to bolster testing and vaccination. Now, as part of local government's efforts to enhance testing as well as vaccine, Janssen vaccines, which require just one shot for full vaccination, are expected to be administered to foreigners who have yet to be inoculated. Authorities stress that any foreigner can get tested and inoculated for free regardless of their immigration status, meaning they do not have to disclose whether they are legal residents or not. The government also plans to inspect and promote COVID-19 prevention measures at more than 23,000 facilities with a high number of foreigners and over 4,700 businesses that employ foreigners. During the Chuseok holidays, they will strengthen antivirus measures at districts with a high population of foreigners at major terminals and the airport. Now, meanwhile, regarding PCR testings, the Chungcheongnam-do province's city of Asan has decided to implement an administrative order for foreigners to get tested for COVID-19, and that because recently around 40% of cases in that city were foreigners.
I see. And on the inoculation front, so I hear questions are being raised about the effectiveness of our vaccines, given the relentless rise, that is, in the daily caseload.
Exactly, Sunny. And those questions also including when we can return to our daily lives. So reassuring the public to get vaccinated, the need for vaccination, despite variants attributed to highly daily cases, Son Young-nae had this to say.
Although vaccines have become somewhat less effective due to the Delta variant, data from abroad continue to show a protection rate of around 70%, which means the spread of the virus can be stopped if more people get vaccinated.
And there were also questions regarding the significance of the first dose, because we keep on mentioning the 70% goal of vaccinating at least 70% with that first dose. But officials are stressing that given that these 70% are possibly going to go to their second dose appointment, that will give us a clearer picture of how many people will be fully vaccinated in the near future, while they are acknowledging that it is, of course, crucial to get fully vaccinated and that this second shot is more important than the first one. Now, meanwhile, there are also talks about more benefits for vaccinated people. Jeon Hae-chul, the Minister of Interior and Safety, said at an earlier meeting that the government is considering to gradually expand vaccine incentives, which currently are limited to allowing private gatherings of up to 6 or 8 people, depending on the level of social distancing. What he also mentioned is that there are plans to reduce the dosing interval between the first and second shot of mRNA vaccines from the current 6 weeks, which followed an earlier extension over the temporary shortage of Moderna supply.
Right, and hopefully that could speed up further our vaccination drive. Right, so as always, thank you very much for that.
Thank you.
Right, curtains have gone up on the 76th session of the United Nations General Assembly, where officials reiterated the need to ensure equal access to COVID-19 vaccines. For more on this session, I have our G. Abili here in the studio. G, welcome.
Hi, Sunny. So as we discussed earlier in the week, the United Nations General Assembly is now in full swing with a new presiding officer. Abdullah Shahid took the oath Tuesday as the president of the 76th UN General Assembly. The Maldivian diplomat laid out his plans at the UN headquarters in New York.
On recovering from COVID-19, vaccinating the world is my top focus. We simply must close the gap to vaccine access. With this in mind, I will be holding a high-level thematic debate on vaccine equity with leading experts and world leaders.
Shahid noted he will be holding a high-level debate on vaccine equity with leading experts soon. He also touched upon the issue of sustainability from the pandemic and said he has already been working with the UN's Economic and Social Council and international financial institutions on this matter. UN Chief Antonio Guterres also highlighted the importance of vaccine equity.
We need to speed up our response to COVID-19 with vaccines, treatment, and equipment for all, not only those with the most.
He added the world needs to invest in all of the systems that support human development, such as healthcare, nutrition, water, education, and protection, as well as full equality for girls and women. He emphasized the COVID-19 pandemic is humanity's common enemy. The new session of the UNGA runs for a year through September 2022.
Right, G. Now, those words by Mr. Guterres are hitting home, actually.
Yeah, for me too. And also his welcome remarks to the president that he could bring fresh perspectives on how the smaller isles are faring.
Right. Now, also speaking of presidents, G, I hear Russia's leadership was also in the headlines recently.
That's right. So on Tuesday, President Vladimir Putin said he was self-isolating after several members of his entourage got sick with COVID-19. The confirmed cases include someone who worked in close proximity to Putin a day prior. The 68-year-old has had 2 shots of Russia's Sputnik V vaccine and explained the situation in a government meeting via video conference.
It's a natural experiment. Let's see how Sputnik V works in practice. I have quite high levels of antibodies. Let's see how that plays out in real life.
Kremlin announced the Russian leader is absolutely healthy. Due to the self-isolation, Putin had to cancel a trip to Tajikistan this week for regional security meetings on Afghanistan.
And I hear he'll be partaking in those security meetings virtually, G.
That's right.
Right. Last but not least, then, what is the latest on the pandemic situation over in Europe?
Well, as many of our viewers already know, many European countries boast high vaccination rates, but Germany has been falling behind its neighbors since June this year. As of now, 62% of the German population is fully vaccinated. More than 55 million people in Germany have received at least 1 dose, and 50 million of those got both. To reverse a slowdown in its immunization drive, Berlin began what it calls a vaccination action week. The German government will set up mobile vaccination centers on public transport, fire stations, as well as places of worship and sports venues to allow for easier access to vaccines. Now that means people around the country can get vaccinated at walk-in sites without an appointment. Chancellor Angela Merkel, for her part, urged unvaccinated Germans to get the shot during her weekly podcast on Sunday. She said, "Never was it simpler to get a vaccination, never has it been quicker." The slowdown in vaccination rate has been a common phenomenon across Europe in the past months as the target of inoculations began shifting toward younger adults in the midst of summer. That's all from me today.
All right. G, as always, thank you very much for that coverage.
Pleasure to be here.
Back on Tuesday, we spoke of one local tour company hoping to make a rebound as its workers return to the office on the back of an active inoculation drive here. Well, today we take a broader look at the tourism industry, including its current trends amid the pandemic.
Last week, a travel expo was held in Gyeonggi-do Province under the theme of preemptive response to the domestic tourism industry after COVID-19.
Amid significant challenges that the tourism industry is facing because of the pandemic, a lot of people across the country have gathered here in anticipation of changes and development in the travel industry.
More than 300 participating organizations, including local governments, overseas countries, institutions, and corporate organizations, have gathered together to promote various local festivals and tourist attractions. In particular, the event drew attention from future tourism services that incorporate advanced information and communication technology into the tourism field.
관광공사에서 이 비대면 시대에 맞아 스마트 관광 모바일 플랫폼을 개발을 했어요. 그거를 통해서 더 편리하고 쉬운 여행을 경험하실 수 있었으면 좋겠습니다.
So at here, you can enjoy a variety of activities that are using VR, AR, or hologram. So what I'm going to do is that I am going to try paragliding using virtual reality. You're on a real paragliding ride. Wow! This kind of technology, you can travel anywhere in the country.
우리나라의 유명한 관광지, 예를 들면 100개에 있는 유명 관광지를 선정을 해서 국내인뿐만 아니라 외국인에게도 우리나라를 홍보할 수 있는 좋은 계기가 될 것 같습니다.
So tourism is one of those sectors hit hardest by the COVID-19 pandemic. According to a survey conducted by the Korea Travel Association, travel-related sales plunged to 83% since the pandemic broke out, and 1 out of 4 travel agencies has closed down their business.
In fact, according to a survey conducted by the Culture Ministry on the COVID-19 damage status, the damage to the tourism industry alone is estimated at over $12 billion last year. However, it is also true that as the vaccination rate trends upward and the country getting ready to shift to living with COVID-19, expectations for travel are rising.
자연 환경 위주의 이렇게 사람이 많이 밀집되지 않는 그런 비대면 투어라고 이제 이름을 붙였더라고요. 네, 그런 쪽으로 많이 개발되지 않을까?
해외 여행이 이제 많이 갔는데 이제 국내 여행을 많이 갈 수 있을 것 같아서 정말 국내 더 아름다운 데를 많이 찾을 수 있을 것 같아요.
Despite the current situation, domestic travel sentiment hit an all-time high in the first half of this year. In the early days of COVID-19, the sentiment fell, but as the pandemic prolongs, it surpassed the pre-pandemic levels. Changes caused by the pandemic can be found in travel behavior as well. Now people rather prefer low-density travel. A survey by the Korea Culture and Tourism Institute showed that the ratio of traveling to less crowded places rose from 58.4% last year to 65.5% this year. And traveling mainly outdoors rose from 37.4% to 44.8%.
위드 코로나 상황에서는 늘 안전이나 방역 문제가 좀 화두가 될 수밖에 없습니다. 진짜 신뢰할 수 있는 그런 관광을 대비해야 될 거라고 생각하고요. 실제로도 시범적인 어떤 관광 재개 프로세스를 통해서 안전하게 운영될 수 있을지 이런 것도 확인이 좀 필요할 것 같습니다.
The pandemic has changed much of our daily lives and of course, including the way we travel. This has been 신세병.
COVID-19 can be characterized as a pandemic. There has been broad consensus this week that equitable access to vaccines is essential for ending the COVID-19 pandemic. And new variants compounding explosive outbreaks, this pandemic is far from over.
When will the COVID-19 pandemic come to an end? Now, that is the million-dollar question. And to answer it, I have Professor Kim Eun-gyu from Yonsei University. Welcome back, Professor Kim.
Thank you for having me.
I also have Professor Monica Gandhi at the University of California, San Francisco, live on the line. It's a pleasure to see you again, Professor Gandhi.
Thank you.
Also joining us virtually is Professor David Dowdy at Johns Hopkins University. It's good to have you with us, Professor Dowdy.
Thanks so much. Pleasure to be here.
Right, we'll start here in the studio then. Professor Kim, let's first begin with your thoughts on the current global COVID-19 situation.
Yes, as Gonza mentioned, there are more than 224 million cases with more than 4.6 million deaths, and more than 5.5 billion shots of vaccines done, and still we have to worry about the emergence of new variants. And one thing I want to emphasize is we have blind spots globally. I mean, there are some areas that we don't have the clear data of the situation of COVID-19, such as some countries in Africa. So nobody knows the whole picture of COVID-19 about this pandemic yet. Well, it's a good news that we might have a drug within the end of this year. And first, I want to compare with SARS in 2003, because it was ended relatively short period, about 100 days or more. And it was brief because transmission happens after the onset of symptom. And this COVID-19 is different. It spreads before you have a symptom. And now we have a variant such as Delta variant, which is highly infectious, and possibly we might have another new variant in the future. Well, it will end definitely, but I would say if we have no more variants such as Delta anymore, it's going to end soon. And if not, it will continue. So I would like to give you 3 scenarios, as people say. I mean, the first one is the worrisome, and I think we would not end that way. But the first one is that we cannot gain control of this pandemic. It will continue for a long time. Second scenario is the most likely, that this COVID-19 might change to some kind of epidemic seasonal infection, such as influenza, which started more than 100 years ago. And the third scenario is a little bit less likely, but it might be similar with other previous coronavirus, which has a small outbreaks in only winter times. So we have to see.
We'll have to wait and see then.
Yep.
Meanwhile, going back to the Delta variant that Professor Kim has mentioned, Professor Gandhi, what is your outlook with regard to the spread of the Delta variant, which appears to be fueling resurgences across the globe?
So, the way it's fueling resurgences really depends on the vaccination rate in the different countries. So it started in India with a 4% vaccination rate, and it did come down, but it was through terrible suffering and terrible death. And then when it went to the UK at a 76% vaccination rate, by the time it hit first dose, it didn't cause the degree of hospitalizations and suffering and death. And so everything is going to depend on the rates of vaccination in a country, how it behaves in that country. I do think that fundamentally it is going to infect a lot of people. It is extremely transmissible, and it's only acceptable for that to happen when there are high rates of vaccination. Otherwise, it will do it through suffering. And so when I look at the United States, there's sort of 50 different countries here, and there are places where we had a lot of cases because Delta is very transmissible, but the hospitalization rate stayed low. My state of California is one of them. And then there were other states where the vaccination rates were low, cases surged and hospitalizations went right up with them. That will actually cause natural immunity in those regions. And you can already see in the South that cases are starting to come down. Nothing to do with masks, nothing to do with social distancing. None of that got instituted. It all had to do with natural immunity.
Right. And given those circumstances, Professor Dowdy, how do you respond now to questions over the pandemic's endgame?
So I think this is a great question. I wish that people would maybe take a step back and stop talking about the end of the pandemic. I really do think that the second scenario that Professor Kim laid out is the one that's most likely, right? We have lots of reasons to believe that this is not going to be something that ends soon or quickly, right? First of all, the levels of vaccination that would be required are proving very challenging, even in the countries that are most advanced to achieve. Secondly, there are going to be populations, kids, for example, who aren't going to have access to vaccines for at least a little while. And even if they do have access to vaccines, you're going to have new kids born every year, and they're going to be born susceptible to this virus. And then third, they're going to, I think, persistently be pockets of unvaccinated people in any country. And these are going to provide the, the basis for potential outbreaks in the future. So I think that it will be very challenging to end this pandemic. That being said, I think that it's a very reasonable goal for us to get the pandemic to a point where it's manageable. We all have learned how to deal with many other infectious and non-infectious diseases, and I think that we can get COVID-19 to that level as well.
Right. Professor Kim, staying with the idea of managing the pandemic then, as mentioned by Professor Dowdy, at what level of containment, generally speaking, can we declare that an infectious disease has been brought to relative control?
Now we are in a pandemic situation, and we have a word endemic, which means constantly wax and wane for many years, and it's one of the scenarios that I'm expecting. We use the word control, which means acceptable reduction of disease in a setting of endemic or pandemic. And if you do better, there's a concept that means elimination of disease, which is a diminution to zero of a disease during that infection. And the more better situation is elimination of infection, which means the diminution of infection to zero in human population. And some diseases even reach eradication, which means permanent reduction to zero worldwide. And I mean, I would say, give you an example of smallpox, but I don't expect that will happen for this coronavirus. Because of the characteristics that coronavirus have, our goal should be elimination of disease temporarily, and it may be possible to reach in some developed countries, but if you think globally, control of disease is more urgent. We have many blind spots, and it's a huge task, and many hurdles remaining in front of us. So somehow a new equilibrium between human and virus will be reached, and we have to do our best to make it controllable.
Right. Professor Gandhi, at the start of this month, authorities in the US were recording over 180,000 daily infections, I believe. Now, there's been a notable decline in recent days. Do you suppose the outbreak over there in the US has hit its peak?
Yes, I think Delta is coming down in multiple areas, in places with high vaccination, again, without the terrible hospitalizations, and in places of low vaccination. There were more hospitalizations, and that was terrible. And now I think the Midwest is still a place where it's going to take a little bit longer to come down. But yes, I think we've essentially reached our peak in the United States. What will control look like? I think what Dr. Kim and Dr. Dowdy said was exactly right. But it's not a terrible way to live. And I think we are in a pandemic situation right now. It is very difficult to live with this. But if you get it to the point where you can take away its ability mostly to cause severe disease by vaccination, then it becomes like an endemic circulating coronavirus, of which we have 4, that we can live with. And then there will be people who won't get vaccinated, and there'll be outbreaks of more severe disease there, just like there's outbreaks of severe measles still in populations that decline vaccination, and we will manage those outbreaks. And now we have molnupiravir, perhaps we'll see, I think at the end of September, it's going to be presented, the phase 3 trials are going to be presented at what's called ID Week, and we may have an antiviral that we can use for more mild infections. So we will get to a place, I think, of control, like Dr. Kim said, and control is a way to live with a virus that is not like this, where it's this disruptive. There will be a way to live with it. It's going to take vaccination, and exactly what you brought up in this program. It does take what the WHO said. It takes global vaccine equity. The idea that we have these vaccines, and there are so many places in this world that have received only 2% of those doses is appalling. And we have to get to global vaccine equity to get this under control.
Right. I have to say, Professor Gandhi, your words sound really reassuring there. Professor Dowdy, what are your thoughts now on the COVID-19 situation in the US?
So I agree with what Dr. Gandhi has said. I do think that we are perhaps over the peak. But I think what's a little concerning is that the downslope after this most recent peak seems to be slower than the previous peak. So we may still be in for a prolonged period at which the level of suffering and death is far higher than what we want it to be. So I hope this is not true. I hope that we're able to start bending the curve a little bit more in the weeks and months to come. I don't think that we are going to be returning to the past waves like what we saw last winter, where our ICUs were overflowing across the country. But I still think we have a long way to go before we can say that this current wave is over, unfortunately.
Right. And staying with the winter, Professor Kim, what are your thoughts on the risks of resurgence here in the country during the colder months of the year?
Naturally, coronavirus is a seasonal disease, and we saw in 2020 that there was a surge in winter times, especially in the United States and some parts of the world. And interestingly, that was the point that they started the vaccination, and there was a huge decline in mortality, but the incidence of COVID-19 increased for a few weeks. Anyway, vaccination together with social distancing might trample down the incidence of COVID-19. I'm sure to believe that, and especially if there's no more variants, that will be evident. Still, we must be vigilant for these new variants emerging, and especially we have to take care about the blind spots globally, and because that might be imported to the countries already in control.
Right, because we're traveling a lot, I mean. Professor Dowdy, some claim at least 90% of the global population needs to have secured immunity before we can start talking about, and I'm not going to use the word end here, but talk about some form of closure to COVID-19. How feasible is this level of global immunity?
Well, so I think one thing to remember is that it's not just about the level of immunity that helps us get to a level of being able to live with this virus. It's also about how we as a society are interacting and behaving, and the level of contact that we're having with each other. I do think that it will be very challenging to get to 90 or 95% immunity, challenging if not impossible. I'm not sure that we need that to get to a level of stability where this virus is again on par with other diseases that we've learned to live with, right? So I do think that we can get there without having to get 90 or 95% of the population either vaccinated or, God forbid, immune through infection. I also would re-emphasize what Dr. Gandhi was saying, that part of this is also about equity, right? That it's not just about reaching 90 or 95% within Korea or within certain parts of the U.S. It's about doing this globally, and so trying to get that number as high as possible everywhere, right? And then doing what we need to do as a society in terms of our behavior, our interactions, to keep the level of infection at a manageable rate.
Right. Professor Gandhi, some 60% of the US population is fully inoculated, and do correct me if I am wrong, but what does this figure mean then in terms of potential herd immunity over in the US?
So it's a great question. I mean, I think the word control is being favored over the word herd immunity now, given that we tossed around the word herd immunity a lot between Alpha and Delta, and Delta really roared back the pandemic. And because of that, I think this phrase control, what would it take to get to control? There was estimates that for Delta, it's much higher than what was required for Alpha. It's likely something like 84% of the population needs to be immune, which actually in the United States does mean that children need to be vaccinated, or at least more than we thought with Alpha. And then what will happen is these childhood vaccines, which Novavax is going to be approved in India as early as January 2022 for children. And in this country, we're hoping October for the 5 to 11-year-olds. And then we're hoping for end of December for 6-month to 5-year-olds that every time someone's born, they'll have to keep on being vaccinated against this. But it is, you have to look at the history of infectious diseases. We've never actually developed a vaccine this fast. It's really very sad that we don't have equity and that there's also vaccine hesitation. But if we had better and higher rates of vaccination, we could be like countries in EU and emulate them. There are countries in the EU, Denmark is one, Ireland is one, UK is one to a certain extent. They opened sooner than these others, but they waited until a certain point and then they opened fully when they had such high rates of vaccination, and they were about 80% close to first dose, and then they were getting the second. At that point, the hospitalization stayed low. That's what control is going to look like. So something like 80 to 84%, keep on vaccinating when people are born, and have some antivirals for those more mild breakthroughs, and be ready for severe breakthroughs if people decline to get vaccinated.
Right. Professor Kim, back here in the country, in Korea, we celebrated Chuseok last year with daily infections on 3 digits, like 100 and something cases or so. This year, we are ushering in Chuseok next week with cases roughly around 2,000, less than 2,000 or 2,000, over than 2,000, that is for today. We have vaccines. We had no vaccines last year. Why isn't the daily tally declining more tangibly?
We're in one pandemic, but with a different variant. So I would like to share, as I work in the emergency department, there was a case with meningitis, a boy, and the mother came with the patient. The patient was negative for COVID-19, but as this family admitted to hospital, the mother turned positive, but she didn't have any symptoms. So that means she could spread the virus even though she had nothing. And she had one shot of RNA vaccination 3 weeks before she visited our hospital. The boy is still negative for COVID-19, but as the mother, we were exposed to the mother, we have to check our medical professionals and disinfect all the areas she was in. So as you can see, COVID-19, especially this Delta variant, is highly infectious and can spread before showing any symptom. The mother is still asymptomatic. So that is the thing, it's difficult from last year. Anyway, I guess Korea is the same situation. We need more than 90% of population gain immunity against COVID-19 to have a safe season forward.
Right. Professor Dowdy, now quite a number of countries, as you mentioned, are now exploring the option of coexisting, so to speak, with COVID-19. Having said that, what are your thoughts on plans to coexist with COVID-19 by focusing on severe cases and easing restrictions?
So I think we have no choice but to coexist with this virus. I think that we've seen in many cases that a policy of trying to have zero infections is, at least with our current tools, just not something that's feasible, right? But I think as has been discussed, getting to a situation where the number of severe cases is low enough for us to live with, I think is very achievable, and many places are, I think, already getting to those stages now. So I think that countries need to be thinking to themselves, like, what is a level of illness, of long-term morbidity, of death that we are willing to tolerate? I mean, obviously the ideal is zero, but that's not possible, right? So at what level are we willing to tolerate getting back to a scenario where we have fewer and fewer restrictions? I also, would encourage people not to think of this as a black or white sort of thing. It's not that it's either complete lockdown or no restrictions at all, right? I mean, we can be smart about this and think about restricting large indoor gatherings, for example, without saying you can't go outside to see anyone, right? So thinking about and calibrating the level of response to the level of sickness that's happening in a given society at a given time.
Right, a very valid point there. All right, Professor Dowdy, thank you very much for your time and your thoughts at this very late hour at your end. Professor Gandhi, as always, it's been a pleasure having you on the show. And Professor Kim here in the studio, thank you for your insights.
Thank you so much.
Thanks for having us.
Right. As one pundit says, the pandemic is bound to have multiple endings that will vary from one country to another depending on the rate of infection and inoculation. Regardless of this reality, though, let's hope for a tangible end to the losses of lives from COVID-19. Thank you for watching.